Welcome, everyone. Please hold tight for 1 minute while we let everyone join the webinar. Welcome, everyone joining us. We're just going to give it a minute while we let everyone hop into the webinar for today. All right, great. Looks like folks are still hopping in to the webinar, but we're going to go ahead and get started. So welcome everyone to our Time for Change webinar by CPEN. Before we dive into the content, I want to make everyone aware that this event is available in both English and Spanish. After I finish this announcement, you will be able to select your language. In order to do that, a world icon will appear on your Zoom toolbar, and you can select English or you can select language. Everyone must select a language. So we're going to enable the interpretation feature now, and I'm going to pause to allow our excellent interpreters to repeat this message in Spanish.
Buenas tardes, mucho gusto, bienvenidos. Quería dejarles saber que este seminario web va a estar disponible en español y en inglés. Por favor, escoja su lenguaje en el globo terráqueo en la pantalla y escoja español o inglés, de acuerdo a lo que quiere escuchar. Muchas gracias y disfruten del webinar.
Great, so folks should see that world icon now, and you can go ahead and click on that, either English or Spanish. Everyone should please select a language so that you can hear throughout this entire webinar. I'm going to give folks just a minute to do that. All right, other housekeeping, want to let you know that everyone is muted. We have a lot of people on this webinar, so in order to minimize background noise, everyone is muted. The webinar is being recorded, and if you would like a copy after the event, please go ahead and email us, info@cpen.org. Closed captioning is available in English, and if you would like to enable the closed captions, please click on the CC closed caption on the Zoom toolbar and click show subtitle, and that should get you to the closed captioning. Other features, we invite everyone to introduce yourselves in the chat, share your name, pronouns, organization, title, where you're joining us from, anything you want us to know about you. If you have a question, please put it in the Q&A feature rather than the chat box. So again, if you have a question, please don't put it in the chat box, put it in the Q&A. That helps us to track the questions, and our CPEN staff will monitor the questions. And then we invite you to use reactions to react to the presentation, react to what we're saying. You'll also find the reactions icon in your Zoom toolbar, so you can go ahead if there's something that really excites you, if there's something you have a question about, etc. You can go ahead and use those reactions. Again, you can use the Q&A feature to put your questions in, and we will come to questions towards the end of the webinar. And if you have any other needs or questions, please drop a message in the Q&A, and our CPEN staff will try to help you out and troubleshoot any issues. So thanks everyone for being here. I'm Kieran Savage-Sangwan.
Soy Kieran. Yo soy she, her.
Serving as the Executive Director of the California Pan-Ethnic Health Network, or CPEN. For any of you who don't know us, we are a statewide health advocacy organization. We are dedicated to advancing health and racial equity, and we engage in policy advocacy. We convene networks, we build power, we conduct community-centered research, and we utilize the power of narrative and storytelling to make change. And again, we'd love to hear who you are as well. So if you haven't already, please drop your name, your pronouns, and your organization into the chat. Love to know who's here in this virtual Zoom room with us. Next slide, please. And next slide, please. So to give a little bit of background on the work that we've done here and what brings us all together today, over the past 3 years, there's been increased interest in and attention to health and racial equity, both inside of and outside of government. Racial inequity is deeply embedded in the history of this country and this state. It is not new. However, the stark disparities in the impacts from the COVID-19 pandemic were highly visible and were inexcusable. And at the same time, people across the country, led by Black organizers and spurred by the public murder of George Floyd, demanded change and forced government leaders to reckon with racial inequity. And so we at CPEN conducted the research that we're sharing with you today with the hope of better illuminating what is happening within our state government, within California state government, to advance health and racial equity, and also to make recommendations on how to further and deepen this commitment. And we strongly believe that our governmental efforts must happen in partnership with the communities served by our public programs. So this report seeks to shed light on the activities of government in the hopes that this transparency can be a first step to increase engagement and collaboration. Next, please. So just a quick, since this is research here, our methods, what did we do? So we really looked at the information available to us in 3 ways. First, we looked at publicly available government documents, things like department and agency strategic plans, budget change proposals, public statements of elected officials and state leaders. Then we interviewed nearly 20 State Department and legislative leaders, including department directors, chief equity officers, and others. Next slide, please. And we utilized an assessment tool to evaluate the equity infrastructure of the state in 4 domains. First, workforce and capacity. Second, collaborative partnerships. Third, equity in organizational policies and practices. And fourth, planning and shared decision-making. Our tool was informed by the work of the California Department of Public Health, so we want to give a lot of credit to them for developing ways to assess this work. And they've utilized an assessment tool that evaluates equity efforts of local health jurisdictions. Our research focused on the departments within the California Health and Human Services Agency and other agencies that are most focused on health and healthcare. So we recognize there's other efforts within government that we didn't investigate through this research that may be related to health in different ways. Next slide, please. So as a quick summary, overall, we did find increased interest in advancing health equity. However, this did not always focus on racial equity, which we will discuss more later in this presentation. We found an increase in internally focused activities, such as making equity a strategic priority, creating leadership positions and supporting positions to focus on equity, and evaluating internal policies and procedures, such as hiring practices. We found a handful of examples of external activities that advance equity, including the Medi-Cal expansion to all, regardless of immigration status, and the focus on communities with the greatest need in the distribution of COVID-19 vaccines. Again, however, these efforts rarely focused explicitly on racial equity. We will talk later in this webinar about our recommendations to strengthen and improve these efforts in order to create transformational change. And again, while we focused our research on the health-focused agencies and departments, these efforts are happening against the backdrop of cross-governmental approaches. And we believe that advancing health and racial equity does require a whole-of-government approach. Next slide, please. So now I'm going to talk a little bit about the research we did do into this whole-of-government approach. Again, with the disclaimer, it's not comprehensive, but we do want to highlight a few actions and points of interest. from actions that have been taken by California Governor Newsom, the California legislature, and President Biden, respectively. So first, California Governor Newsom, taking us back a few years, on his first day in office, Governor Newsom issued an executive order that explicitly named health disparities and did establish the Office of the State Surgeon General and that position with a significant focus on childhood trauma. The governor followed that with a historic apology to Native Americans and the establishment of the Truth and Healing Council. And in 2022, after significant advocacy from communities, he issued an executive order to establish a Racial Equity Commission. While the Racial Equity Commission and other elements of the executive order are historic, they also fall short of efforts that we see by the federal government and in other states such as Oregon and Washington. Next slide, please. The legislature, it's hard to evaluate because the legislature does so many different things, right? But the legislature has passed a number of bills tackling health and racial equity, chief among them the establishment of the Reparations Task Force, which completed its work earlier this year and issued a robust set of recommendations. We highly recommend checking out their report and really spending some time digging into it if you haven't already. The legislature also advanced, although did not send to the governor, SB 17 by former Senator Richard Pan, which established a racial equity office and was a precursor to the governor's executive order that we mentioned on the last slide. The legislature has also established a number of select committees, a few are listed here, to sort of study different aspects of equity. Some have more outcomes than others. Next slide, please. And at the federal level, President Biden, somewhat similar to Governor Newsom, on his first day in office, on his inaugural day in 2021, issued an executive order which required agencies and departments to develop public racial equity plans, to conduct equity assessments of key programs, and to consult with communities, among other requirements of that executive order. This was followed earlier this year in 2023 by a second executive order that strengthens and continues the work, requiring agencies and departments to allocate resources to the implementation of their equity action plans, among other elements. As a result of these actions, the Federal Health and Human Services Agency has developed an equity action plan that actually reprioritizes some resources, both for long-term policy and systems change, and for immediate work to address the specific and stark health inequities facing the Black, Native American, and Alaska Native communities. Next slide, please. So when we look at the actions of these three levels of government taken together, we see significant opportunity for California to do more. What you see here are what we feel are some key elements of each what California governor, the president, and the legislature could be doing compared to some of these specific efforts. The executive order creating the Racial Equity Commission by Governor Newsom, the two executive orders around racial equity by President Biden, and Senate Bill 17, which was advanced by the legislature. And we see, for example, that the governor's executive order does not define racial equity. It doesn't include measurable or transparent markers of progress, and it doesn't commit ongoing resources to these efforts. However, we would know some resources have been dedicated to the Racial Equity Commission in later acts of the governor, including the budget process. And neither the governor's executive order nor the president's executive order really move beyond consulting with communities to actively sharing decision-making and sharing power, which is essential to really the transformational advancement of health and racial equity. So now I'm going to introduce Ignatius Bao, who is a health equity consultant. He's partnered with CPEN for a long time, worked with us to develop this research, and Ignatius is going to talk about strategies that we see California departments and agencies pursuing and how this all comes together. Ignatius?
Thanks, Karen, and hello, everybody. So if we go to the next slide, a couple of strategies that we began to see and want to really lift up, and then Carrie will talk about these in the recommendations later on, are ways in which California agencies and departments use data, health equity tools, actually did engage Californians, both directly and in partnerships with community-based organizations, started to collect data and report data about suppliers and contractors, as well as governing boards of regulated organizations. And then, as Karen has already mentioned, use the processes of both the state budget and legislation to drive some of these equity activities. What this analysis also really highlights is the need for this whole of government approach, that each agency and department, while it has a lot of work to do internally in terms of its own infrastructure, staffing, leadership, training, et cetera, that ultimately this has to be coordinated across departments and agencies. And there's a lot of opportunity to do that. There are some examples where that has started to happen, but we see a lot more opportunities. So I'm going to briefly talk about each of these and point to some examples that we noted. So when we talk about health equity, when we talk about inequities and disparities, the first issue always is that we need the data that reflects where those inequities are. And once we can identify and understand how those inequities and disparities show up among Californians, then we can target the resources and the interventions and the activities to reduce those disparities and inequities. And so, yes, at the agency level, at the Health and Human Service Agency level, there is now this data exchange framework that sets some standards for how data is to be exchanged electronically that includes demographic data standards. And so this will be an important first step in establishing that uniformity, that set of standards for all who have health information and data to be able to exchange that with each other. That includes demographic data like race, ethnicity, language, and ultimately disability, sexual orientation, and gender identity as well. Next slide. In terms of health equity tools, we wanted to note that, again, this work has been done before by many other state and local governments through something called the Government Alliance on Race and Equity. Here in California, we've had the Strategic Growth Council sponsor the Capital Collaborative on Race and Equity and do internal work with agencies and departments across California state government. And we will see how some of these activities that have been long-standing even before 2019 and 2020 can be real opportunities for all agencies and departments to participate in. On the legislative side, the legislature is starting to adopt some of these tools by encouraging the use of what is called an equity impact analysis as part of existing committee and floor bill analysis. And then finally, we expect that the Governor's Racial Equity Commission will also develop these kinds of methodologies and tools to be used across state government as a whole. Next slide. In terms of engaging Californians served, this is probably the place in which agencies and departments had the most to learn and to do. We saw very few examples, unfortunately, of this direct engagement. One of the examples that we did note is a very recent example where the Department of Healthcare Services has reorganized and redesigned its Medi-Cal member advisory committee to actually include actual Medi-Cal recipients. And so this is a promising practice to actually engage those who ultimately are served by these California government programs and services to actually be advisors or in how those programs are shaped, implemented, and evaluated. Next slide. So in terms of community-based partnerships, CPEN as an organization that is a network of different community-based organizations finds it really important that the resources that California state government has is actually shared with community partners and not simply kept within state or local government agencies. And so we point to two examples: the California Department of Public Health, California Reducing Disparities Project, the CRDP, which focused on mental health disparities that included significant funding to community partners, both to identify and then ultimately evaluate community-based interventions around mental health. Now we have, as part of COVID, the Department of Public Health administering the Community Equitable Recovery Initiative, which again is partnering with community-based organizations directly as we come out of COVID. Next slide. Another really interesting practice from several departments and agencies that we saw is something that probably has not been paid attention to very much, which is using what in the corporate world is called supplier diversity. In other words, thinking about who California as a state government purchaser, a procurement agency that engages in contracts and also regulates different types of organizations and entities, can also ask about the diversity of those contractors, those vendors, and those entities that are regulated. So the California Public Employee Retirement System, the California Department of Insurance, and the California Department of Healthcare Access and Information all have supplier diversity programs. Department of Insurance over insurance companies, the Department of Healthcare Access and Information over hospitals, where they're looking at the diversity of these suppliers and contractors, asking for data, and then reporting that data. So that's something, again, that we think can be done by more agencies and departments across the board. Next slide. And then, as we're noting, and we'll continue to highlight, that a lot of this, if it is truly transformative, needs to be incorporated into the state budget to actually allocate hard dollars to equity activities and to reducing disparities. And then state legislation that you're going to hear some additional examples of, which has driven agencies and departments like the Department of Managed Healthcare and the Department of Healthcare Access and Information to convene advisory groups and to make regulatory changes that will influence equity both for health plans and for hospitals. There's much more that can be done through the state budget and through state legislation. And these are, again, examples of how to move this work forward. Next slide. So then the final part is to come back to, just as we need a holistic approach to health, we also need a holistic approach to racial and health equity. And so last year, we are gratified to see multiple agencies and departments, including Covered California Department of Healthcare Services for Medi-Cal, the California Public Employees Retirement System, CalPERS, and the Department of Managed Healthcare begin to use similar quality measures with health plans that they either contract with or regulate. It require those quality measures to be stratified by race and ethnicity and eventually language and other criteria, and then to monitor those quality measures to make sure that disparities are being reduced. So this is one example where, in this case, 4 agencies and departments are working together. There are many, many more opportunities for agencies and departments to be aligned, to move their efforts so that they are overlapping and provide that kind of clarity in terms of how to advance health equity. So with that, let me turn to the final slide to repeat that it's budget and bills through legislation and data, that it's important to highlight civil rights enforcement when needed. And we'll talk more about that, Carrie, when we talk about ensuring access for all Californians to these programs and services. And also recognizing that this kind of transformation takes time and leadership. And so future recommendations that we're going to discuss talk about the internal changes that provide that kind of leadership and infrastructure within the department and agencies themselves. And then finally, coming back to this idea that this is not, while it's a whole of state government approach, it also has to engage the diverse communities of California that have been experiencing these inequities over decades, and that the people of California who are served by these programs and services need also to be part of the solution. So let me now turn to Carrie to talk about the recommendations from our report.
Great. Hopefully folks can hear me. Good afternoon. Carrie Sanders with CPEN. As Karen and Ignatius mentioned earlier, our recommendations are based on our interviews with 10 agencies, and that includes the 6 health-focused agencies at Cal HHS. We also spoke with 3 non-Cal HHS departments, covered California, CalPERS, and CDI, as well as 7 legislators and the Office of the Governor to help inform the recommendations that I'm going to share with you now. Next slide. So our recommendations fall into 7 key strategies. The first really being establishing common definitions of equity. The second is, focusing on accountability and improving accountability mechanisms. The third is around hiring, so expanding training opportunities and hiring staff and leaders with lived experience. The fourth, developing and enforcing standards for collecting and reporting demographic data. The fifth, establishing robust community partnerships, committing ongoing resources to addressing historic harms, and then finally ensuring that all eligible Californians can access services. Next slide. In terms of our definitions, the way the state is defining equity and racial equity, our assessment uncovered a lot of variation in the way each agency or department defines equity, with some not defining equity at all. And the lack of this uniform definition or definitions for equity and racial equity really threatens to dilute the power of interventions intended to right historic wrongs when it's not an explicit and standard definition. And so, our first recommendation is really making an effective definition of equity that explicitly includes racial equity, and that definition be a common definition that's actionable rather than just aspirational. And an important way of doing that is by acknowledging both in the definition the historic harms and the goal, which is to address those harms. We also looked at other states like Oregon and Washington, and they have very promising examples that California can refer to. But forums already exist where some of these discussions could happen. Cal HHS's work group, they have an equity work group. The Strategic Growth Council has a training program on equity, and the governor's new Racial Equity Commission. Next slide. The next recommendation is around strengthening public accountability. Agencies and departments can really work to strengthen this by embedding health equity and racial equity explicitly in their mission, vision, and values, which is, a goal that we understand that the administration is moving forward. But as part of that there needs to be comprehensive and publicly available agency-wide racial equity and action plans. And those plans, should be shared and made and updated regularly as a potential tool, accountability tool, and as a way for stakeholders to provide input and view progress, the state's progress towards meeting these goals. It's also important to invest in external evaluation and communication of results. And again, there are existing tools that California can use. For example, this assessment really is the first to try and inventory equity activities across California agencies and departments. But policymakers could also use tools such as the Department of Public Health's own assessment tool to turn this into, an annual process and report. And also that report can serve a double function as a communications, evaluation, and accountability tool. Next slide. The next recommendation is around hiring dedicated staff with lived experience. And, you know, there are a couple things that, including with lived experience. New requirements like Cal HHS's directive for agencies and departments to hire health equity officers are starting to come fruition. Many, but not all of these new leaders in these positions have positional authority, staff, and decision-making power to move an agenda forward. This really needs to be, you know, a standard across all departments, agencies, and positions. State agencies can also make it a priority to hire dedicated staff with lived experience. Some agencies are already experimenting with how to do this, and these efforts could further be advanced through a shared definition of what lived experience really means and how to properly evaluate it, along with an investment in recruitment, onboarding, and training processes to do it right. And then finally, you know, in addition to hiring staff with lived experience, really ensuring that all staff are trained, whether it's through, you know, the C-Corps, which is the sort of state training program, or through other HR and diversity, equity, inclusion efforts, really ensuring that all staff and legislative staff are provided training on racial equity, diversity, inclusion, and trauma-informed policies and practices. Next slide. The next recommendation is around collecting and reporting data. And really, you know, we view this as a cross-cutting strategy, as Ignatius mentioned earlier, but it involves reporting data disaggregated by race, ethnicity, language, sexual orientation, gender identity, and disability status at a granular level that really provides, you know, the level of information and detail needed to be actionable. As part of that, you know, where there are gaps, those gaps really need to be identified and addressed. But, you know, ultimately, we want to see this data available on public data and dashboards so that people can, you know, individuals, consumers, advocates, researchers can access this data, and the state as well to make improvements. This is, you know, this will require, you know, cross-departmental collaboration and alignment. One area where, you know, that we think is really promising is California's data exchange framework, which, you know, we hope will adopt state standards for granular demographic data. And, you know, perhaps through this, you know, if the state commissions analyses and reports that are stratified by the standardized granular data, that can also help to, you know, continually drive improvement as well. Next slide. Next is establishing robust community partnerships. And, you know, again, California's department and agencies are experimenting with this. Ignatius, you know, mentioned DHCS's new Consumer Advisory Committee, which is very exciting, you know, bringing beneficiaries to the table. And hopefully, you know, examples like that can yield important lessons that can be shared with other departments that are interested in engaging in similar initiatives. These types of initiatives, to be successful, need to be strengthened across all departments and agencies, and properly resourced so community members can truly engage. It also requires engaging stakeholders through processes that are equitable, transparent, accessible, and include, you know, a shared decision-making and real community partnership. Next slide. Almost there. We've got just 2 more to go. So the next recommendation is really around committing ongoing resources to addressing historic harms. We've seen in the past few years, you know, various efforts to advance equitable policies, whether it's, you know, health for all, investments in housing, et cetera. And, you know, we need to continue that momentum by funding state policies that explicitly address the historic harms of racism, including recommendations from the Reparations Task Force. They have over 115 recommendations that they put forward. We also urge the state to enact laws and issue regulatory guidance that promotes strategies that explicitly address structural racism and discrimination, provide ongoing funds for partnerships between government, community-based organizations, clinics, tribal organizations, and California residents. The Health Equity Racial Justice Fund is a really important example of this, that, it's a, effort, a multi-year, cultural effort that, has not yet, been approved, but is so critical to ensuring that there are local funds provided directly to stakeholders to identify and address pressing health and racial justice issues. And perhaps equally important is the need for resources for state staff to be able to engage with stakeholders at this more intensive level that will really be required to gain results. Finally, on this slide, there is an opportunity in the next few years as Cal HHS has instructed agencies and departments to update their strategic plans through perhaps engaging in regional roundtables that could bring local stakeholders to the table to really provide input into the direction of our state programs and departments. Last slide. Finally, ensuring all eligible Californians can access services. There will never be full equity until all eligible Californians can successfully access the services they need. And this has to be really an intrinsic core value and objective for all agencies. There are various ways to do that, including really thinking and setting annual targets that are aimed at reducing gaps in coverage and utilization, evaluating progress and developing action plans for reducing identified disparities, establishing and enforcing standards for cultural and linguistic access, and access for individuals with disability, and at appropriate health literacy levels. And finally, providing explicit ongoing funds for community-based outreach and enrollment. This needs to happen not just at times, when a new program is implemented or during times of transition or change, but at an ongoing, sustained level, if we are truly going to be fully accessible. And with that, I'll turn it back over to Kieran for our Q&A.
Great, thanks so much, Carrie and Ignatius. If folks haven't had a chance to put your question into the Q&A, please do that now. We have a couple good ones already, but want to invite people again to use that Q&A feature, put in any questions that you have for us, and we will try to get to those. So first, we have a couple of questions about data. And, we talked about what departments are already doing around data and the importance of making our demographic data and our use of data much more robust in order to drive improvements in equity. So there's one question about how is California defining the granularity in which we should be disaggregating race, ethnicity, language, and also SOGI data? And are there other state or federal standards that we should be looking at as examples for how to appropriately disaggregate data to capture disparities? I know both of you are experts on data, so.
I was going to say, I don't know, Ignatius, if you want to go first and I can jump in.
Sure. So I think one of the things that we found was that there are no uniform ways in which every department and agency, and frankly, even within each department and agency, from program to program or activity to activity, how they're collecting the data and to what level of disaggregation or granularity. We are hopeful that this California Data Exchange Framework, which reflects the ongoing work at the federal level to create these standards, will be sort of the standard that gets adopted across all departments and agencies, but we're not there yet. And then in terms of especially the disaggregation, it is going to take time for all the different collectors of data, whether they're payers or providers or the state government itself, to collect the data in sufficient ways so that they can become reported and meaningfully analyzed. And so it's a long process. It has begun with programs like Cover California and Medi-Cal, but it will need a lot more effort and resources. And the recent state auditor's report about the shortcomings on sexual orientation and gender identity data really show how much more work really needs to be done that makes sure that this data gets collected and used.
Great. And I would just add, I think another barrier is, we have actually passed laws, AB 1726, and other, laws to require more granular collection reporting of data. Cover California requires the collection and reporting of, as well as Medi-Cal of data at the patient level. But we need, better enforcement. And so, part of that involves really, to be blunt, is tying payment to data comprehensiveness. And, we hope to see more of that and less excuses around, being able to collect that data so that we can truly move forward here. But it will also require, continued investments as well at the state and other levels, and that needs to be a priority if we are to truly identify and address disparities as well.
Great. And another data-related question someone had was around the use of different tools that are more place-based when we have gaps in our demographic data. And I'm wondering if either of you can comment on whether we see what you saw in terms of the use of those in government and what you feel like the impact is.
I can start with that. I think, I know as more and more departments and agencies, are looking at data requirements, we're seeing tools like, area-based social indices. People are talking about these. They're talking about, can we use these? And I think our, they can be somewhat helpful in filling in gaps, but it's not a replacement by any means for the gold standard, which is really self-reported race, ethnicity data and data at the patient level. That is really where, we will get the most information that we need. The other thing I would just kind of highlight, we have seen these tools used in different venues, whether it's, COVID-19 with the vaccine equity metric and reopening. And there has been some, they do have an important, can be important tools and have important uses, but they must also be, for them to be successful, paired with input directly from, impacted community members, and an understanding of the limitations of these tools. These are area-based, census-based tools, but a lot of smaller, racially, ethnically diverse communities are dispersed. So if we are just looking at, essentially using census data, we're only going to be seeing big blocks of communities, and we're going to be missing the details. And we saw this again with COVID when, folks at UCLA had to essentially design a tool specifically to capture the impact of COVID on the Pacific Islander community, because they were getting lost in this, in these broader tools.
Thank you, Carrie. Another question is about, we talked about state departments needing to engage more and better with communities and with community-based organizations. One issue that's come up is difficulty contracting with the state, for community-based organizations to contract with the state. Can you talk a little bit more? Did you see any solutions to that in the departments that you interviewed?
¿Puedes hablar un poquito sobre las soluciones que has visto en tu departamento?
I can take that maybe, and then Ignatius, if you want
Puedo
to
hablar
add.
sobre eso y ya si algo pueden ustedes agregar algo más.
And I don't know if it's just me, but I can
No
hear
sé
the
si
translate
solo
interpreter.
soy yo, pero puedo escuchar a la intérprete.
Okay, and maybe that'll help. So I think
Creo que
one
eso
of the
puede
things-
ayudar.
Oh, can folks still hear me or?
¿Me escuchan a mí o están escuchando a la intérprete?
Okay.
Ok.
Should I just move forward? Great.
¿Me están escuchando bien?
So I think one
Para
of the things
continuar,
that we've
una de
heard
las
is,
cosas que he
in
escuchado
talking to different
es
agencies,
que de lo que he
some
hablado con las
agencies felt like
diferentes,
they had never contracted with CBOs before and they weren't exactly sure how to do that. There seemed to be an interest, but really also an interest in hearing how other agencies and departments are doing that. I think we had the benefit of being able to talk with a number of different departments to share our findings together. And that was a really interesting conversation that sort of, happened spontaneously between departments and some potential learnings about, models that can work and models that maybe might be more, beneficial to really engaging stakeholders. But again, there is a resource component and a time component. And those are very important considerations for all agencies and departments, and really engaging at the levels that will bring authentic engagement.
Great. And we have a question about Prop 209, which we mentioned. It came up in our interviews, is sometimes seen as a barrier. Ignatius, can you talk a little bit more about that? That's really helpful. Thanks, Ignatius. Another question is, we talked about the importance of a definition. Is there a good example of a definition of health and racial equity that folks should be looking to? And speaking of Oregon, we also had a question. We had mentioned when we talked about what the governor has done and sort of what might be happening in other places, that there's some other good examples of what state executives, state governors have done. Can either of you talk a little bit more about some of those examples? And I'll just, facilitator's privilege, say we didn't do sort of a national landscape scan. So these are a couple of examples that we knew about, but there may be others out there from other states. But Ignatius, go ahead. That's really helpful. And we also have a question about the racial equity plans in California. So just for clarification, those are not public. Those are not made public by our state departments, which is what was being asked. And that is one of our recommendations. Those should be not only done in partnership with community, but they should also be transparent, and departments should be open to being held accountable by their constituents for their work in those plans. So if anyone's got one final question, drop it in. Otherwise, we're going to turn to sort of the set of questions about next steps. So one question we have is, does CPEN plan to reevaluate government programs at some point to measure progress? I will say we are planning some additional research related to this, actually both for the state, making recommendations for the state and also for local governments. That'll be coming out later this year, and then early mid next year. I don't know if we're going to repeat exactly this analysis. We may, but one of the things that also came up for us in doing this work is that we do think it would be beneficial if somebody, not necessarily CPEN, did a broader scan of what's happening across California state government with regard to equity, because certainly there's things that our work didn't touch on that are important to really look at and figure out how are they working, how can we do better. Another related question was, what are we planning to do next with this research, which I, touched on. I think there's additional steps to go deeper into the recommendations. We are also principally an advocacy organization, so we do plan to advocate for many of these recommendations and to work with government, but also with our community to really see progress and really see implementation around these, which takes us to the very last question, which is how can I help? And so we really would invite all of you to be partners with us, whether you're on this webinar because you are a state government leader and you want to find out what are some opportunities for you. We really invite your partnership, invite you to reach out to us. We're happy to have more conversation with individual departments and leaders. But most importantly, if you're a community member, a community advocate, and you really want to see your government really taking additional strides, committing to meaningful changes for health and racial equity. You are the heart and soul of the work that we do at CPEN. If you're not already engaged with us, we would love to be connected with you to bring you into the collaborative work that we do. And so please reach out to us. We're really easy to find. We're info@cpen.org. We're also on social media. And if you're not on our listserv, we send out a lot of information about our continuing work that way. So really welcome the partnership. We really believe that that's how change happens. So thank you all so very much for your time in joining us today. The full report is available via our website. Welcome all of you to read that and to contact us with any questions, comments, feedback, etc. So thank you all so much again for joining us, and have a good afternoon. Thank you, Jane. Thank you so much to our interpreters. Really appreciate it.